suffer from obstructive sleep apnea, there might be a non-surgical alternative for you.
We have Dr. Chris Chapman. He's from the Lift Clinic in today's sponsored interview. And can we start with the basics? First, everybody's tired. So if you are, watch this segment. This might be something you're dealing with.
Right.
What is sleep apnea and how do you know if you have it?
Okay, so sleep apnea is an obstructive. There's two kinds, central and obstructive. Obstructive is when the airway closes off. And so when the airway closes off and it shuts down and it gets small, you have difficulty breathing. And so we all know breathing is super important. Wake breathing and sleep breathing. So obstructive sleep apnea is just a blockage of the airway. And the CPAP, which is kind of the next segue of a question, works because it forces air through a small closed down aperture of your airway. There are other options for that.
If you are waking up and you are feeling maybe some tension in the jaw, maybe you know you're grinding your teeth, are these all symptoms that you might be suffering from sleep apnea?
Yeah, so it's a great question. So the clenching and grinding of your teeth at night when you're asleep is something the body does to mitigate or open that compressed or constricted airway, which oftentimes just gets sloppy and relaxed and closes down. And so the body will go into a clenching mechanism which stresses the teeth, the jaw joints, the muscles, which cause morning headaches, jaw pain, or often we call this TMJ, or sort of just like excessive wear and tear on the teeth.
This is so interesting. If you're having migraines, that's sometimes a sign of sleep apnea?
Yes, it's a pre-apnea sign. So it's something the body does to keep you breathing at night. This is handled by part of the brainstem, which keeps you breathing and doing all these wonderful things that you don't have to think about. And so it takes over and it clenches and grinds at night so you can stay breathing, but you wake up with some of the, paying the fiddler, which is basically the jaw pain, head pain, neck pain, that sort of thing. So that's an early warning sign.
You mentioned the spine. How does that relate and tie in?
Well, so the areas that actually govern and regulate breathing are central nervous system stuff. So that lives right at the very top of the spine, right at the craniocervical junction. It's where the head meets the neck.
Is that what we're looking at right now?
This is what we're looking at right now. And so when this toggles back and forth, you can see that area, which is really sort of managing autonomically these basic functions like breathing and sleeping. And so when that area becomes not functional, not as ideally functional as it could be, then it affects the breathing centers. Then the airway gets smaller, just like if you have a nerve damage and the muscle starts to atrophy and gets weak. It's the same sort of principle.
How do you treat this at the Lift Clinic?
So we have, so first we vet our patients quite well. So first and foremost, we do a complimentary consultation. And what we do is we actually make sure you have this type of problem before we actually will do any sort of procedure or even accept you as a patient. But if you have this problem, it's very discernible on 3D imaging. We get to look at the craniocervical junction and look for any malpositions there that might be affecting the central nervous system, which controls the airway. So it's a domino effect, so we have to look for that. And then we do a non-surgical procedure that repositions that area.
Is that what we're looking at?
Yeah, so what we're looking at here is the colored structure here this is the pharynx, or the upper airway. This is actually pre-post procedure. This is probably within 5 minutes after the procedure. We get this much volume changes and functionality.
Opened up.
Completely opened up.
Okay, if viewers are watching and they're saying, that's me, or that's the person sleeping next to me,
that's the person
I
sleeping
know,
next to me, yeah.
Where can we find more information and see you?
If you go to theliftclinic.com, it's the Lift Clinic, as in lift, so theliftclinic.com is where you can find us. And we have a whole system that helps you integrate into our practice and either figure out if we can help you or if we can't help
Well, if you have questions, they have answers, everybody. Free consultations with imaging during the month of May. Go to our website for all this sponsor content, abc4.com/GTU. They're located in Salt Lake City, so there is hope if this is something you are dealing with.
Yeah.
Thank you, doctor, for being
You're
here.
very
Thank you
welcome.
so
Thanks for
much.
having me.
Up next, home loans.